We now move on to the median nerve, mononeuropathy, common site of injury, carpal tunnel at the wrist. Please take a moment and identify the median nerve in the schematic. With the median nerve, clinical features include the following: dropping objects, numbness, tingling in the hand, wrist, thumb, index, and or the middle finger. May radiate up the arm and occasionally up into the shoulder. Symptoms primarily at night. Patient wakes up and shakes their hand to obtain relief. Median nerve damage, most commonly carpal tunnel in the wrist. Onset usually slow, insidious, over months to years, is the most common pathogenesis. Risk factors: women, diabetes, pregnancy, weight gain, trauma, HIV, working with lots with the hands. In other words, you're typing, secretaries, homemakers, operating machines, computer joysticks, factory workers, and so forth. Pretty big deal in the U.S., isn't it? Take a look at all these occupations. Quite a large population at risk for median nerve damage or carpal tunnel syndrome. The physical examination for the median nerve: test the abductor pollicis brevis, APB. Strength: push the thumb upward against resistance. Positive, what's known as your tenosyne, tingling upon tapping the nerve. At the wrist, usually with appropriate radiation to fingers with symptoms. Recommendations for median nerve injury: stop, address the cause of the problem. So if it is a patient who's been, let's say, in the world of gamification and has been using their hands quite a bit for game controllers and such, then unfortunately you would have to recommend to that patient to ease off and balance what they're doing, because they might not even realize as to how much damage that they're actually causing. Treat diabetes if present. Address weight gain. Wrist splints, most at night. Remember, once again, you wake up in the middle of the night because of the pain. You try to shake off, quote unquote, the pain. Steroid injections. And unfortunately, when there's enough of this median nerve damage and carpal tunnel syndrome, then surgery may be indicated in severe cases, but you want to try to avoid that as much as possible. Spend a little bit of time, please, with the management of median nerve damage on this slide so that you are able to address your issue appropriately. Do not choose surgery first if you know for a fact that you could do lifestyle modifications. Always, actually. Differential diagnoses: repetitive stress injury to joint or tendon, cervical root lesion, and thoracic outlet syndrome. Very rare, but nonetheless a differential.